The ramifications of COVID-19 and the instability of current events have placed an enormous amount of strain on our mental health. Yet 1 in 5's mission of preventing suicide by erasing the stigma of mental illness and promoting mental wellness remains the same. As we partner with an increasing number of schools and neighborhoods, our services have never been more important. We continue to work to achieve our vision of a world without suicide and a community of people with optimal mental health.
Our goal at 1 in 5 is to equip schools with tools to implement a progression of mental health programming that becomes embedded into their school culture and impacts the entire student body. Working with over 125 schools and universities across Greater Cincinnati, we utilize an evidence-based program guide to make recommendations based on each school's unique culture and climate. Our comprehensive mental health education and suicide prevention programming helps students, staff, and caregivers recognize the signs and symptoms of a mental health condition and know how to respond when someone's experiencing a mental health crisis. Because each school is unique, there is not a one-size-fits-all model. Needs assessments and climate surveys help us create a customized, long-term strategic plan with proper mental health treatment providers in place for each school. Through 1 in 5 school programs last year, nearly 200,000 local students were impacted.
1 in 5 is implementing the same evidence-based programming across the community as well, in collaboration with trusted community partners, workplaces, and social service agencies. All of 1 in 5's programming is intended to normalize mental health and break down the barriers preventing individuals from seeking help. Through these partnerships, 1 in 5 is able to blanket the entire region with mental health education, which helps all individuals build resilience, increase knowledge, and strengthen protective factors. In 2022, 1 in 5 provided more than 250 educational talks across Greater Cincinnati, reaching over 27,000 individuals who may never have connected within a school setting.
We know the need is great for this life-saving work. The deteriorating mental health of youth has become such a significant public health challenge that U.S. Surgeon General Dr. Vivek Murthy issued a Protecting Youth Mental Health Advisory in December of 2021. It is a call to action for all of society, and he cites that the obligation is not just medical, but moral as well. Surgeon General Murthy wrote, "The challenges today's generation of young people face are unprecedented and uniquely hard to navigate, and the effect these challenges have had on their mental health is devastating. Mental health challenges in children, adolescents, and young adults are real, and they are widespread. But, most importantly, they are treatable and often preventable."
Approximately 1 in 5 individuals in the United States experience a mental illness in any given year. This includes 10.2 million people between the ages of 18 and 25, where the rate is as high as 1 in 3. Even more staggering, 26% of those between 18 and 24 report having seriously considered suicide in the past 12 months, and suicide is the second leading cause of death for children and young adults. We know that 75% of all mental health conditions are present by age 24. Yet still today, it takes 8 to 10 years for someone to seek treatment. 1 in 5 seeks to change these alarming statistics by stopping the stigma and starting the conversation.
As you can see, the need is great, and mental health impacts all of us in some way. We hope you will walk with us to address this crisis in our youth, helping us change the state of mental health and wellness across our region. None of our work would be possible without a team of people, a dedicated community, the voices of our youth, and a vision of a world without suicide.